What if the billions spent on imprisoning nonviolent drug offenders were instead redirected into treatment centers, counseling, and societal integration? The United States justice system relies too much on imprisonment for such low-level offenses, and this imprisonment has little to no effect on the safety of our communities. This is because addiction is an issue which must be addressed medically rather than criminally. The evidence is clear. The United States should rehabilitate rather than imprison nonviolent drug offenders because rehabilitation would lower the cost of incarceration, decrease the overall reoffending rates of the United States, and because it better addresses the mental and physical barriers to addiction. First, the cost. It is a matter of cost compared to impact when discussing whether rehabilitation or imprisonment should be used to redirect nonviolent drug offenders into participation into society. Social workers Brock Smith and Monique Alires explained that $56.6 billion is spent annually on the imprisonment of nonviolent and violent criminal drug offenders. If we redirected some of these funds used to incarcerate nonviolent drug offenders, the United States could save upwards of $2 billion on the funding, housing, and feeding of these individuals. These funds could instead be redirected into rehabilitation, the more effective and less costly option. Criminology professor Arouj Khalid explains that rehabilitation leads to less overall crime and increased communal participation of rehabilitated individuals. This would therefore lessen the weight of the overall cost of incarceration, however, will have a greater and heavier impact on society. Furthermore, stability and life skills are the two things which rehabilitation addresses but imprisonment fails to do. Criminal justice researcher Shedika Bailey explains that substance abuse treatment, education, and employment opportunities are the three things that imprisonment does not address, but rehabilitation does. Imprisonment is not effective, as says Nancy St. Clair. If locking people up really solved the problem, we wouldn't have so many repeat offenders. This licensed addiction counselor is right. Prisons promote addictive behaviors rather than curb them. As explained by law and criminology professor Louis Favril, a third of individuals continue drug use during their incarceration. As you can see in this chart, a large number of individuals have experienced drug abuse pre-imprisonment. However, just as many of these individuals continue or initiate drug use while they were incarcerated. This shows an ineffective method to curbing addiction in these individuals. Researcher Christina L. Lyons explains community restorative conferencing, something that is a part of rehabilitation but not a part of imprisonment. This restorative community conferencing introduces good morals and curbs some of the effect of depression and anxiety on individuals, which lead them to continue drug use. Additionally, rehabilitation better addresses issues by using counseling, medication, and redirection in their rehabilitative process. Social behavior researcher Kui Wang Young explains the psychological and physical barriers to addiction that rehabilitation works to curb. And individuals in rehabilitative processes have access to specialized treatment which help remove some of the mental and physical barriers. Imprisonment does not address these barriers. Health specialist Catherine Fullerton explains medication-assisted treatment, something that rehabilitated individuals are given access to. This decreases some of the physical barriers to addressing addiction. For example, opioids are a very addictive drug, one that withdrawals can lead to physical symptoms which negatively impact your physical and mental health. In many cases, medication is the only way to overcome these symptoms. Imprisoned individuals have no access to medication and therefore experience extreme distress while they were incarcerated. This leads to a greater chance that these individuals will continue to abuse drugs while they are imprisoned and after they are released. Thank you for listening. The continued imprisonment of nonviolent drug offenders has proven to be both costly and ineffective in addressing the root causes of addiction, while rehabilitation produces a more practical solution which provides individuals with the needed resources to achieve long-term recovery. Thank you.